Working as a community transportation driver is important and rewarding. The individuals we transport come from a wide variety of backgrounds and experiences. Each person has his or her own physical, emotional, or cognitive conditions, which lead them to seek the services we offer. It's our role as a driver or escort to provide safe, reliable services to our passengers. You are the key to our success, and our goal is to offer you the knowledge and support needed as a community transportation driver.
Many of you have heard about the spread of AIDS, the acquired immunodeficiency syndrome, throughout our nation and around the world. So, what are the job risks involving AIDS and other bloodborne diseases? This training is designed to inform and dispel any confusion about biological hazards and teach you the best methods for protection against any possible threat of exposure. Bloodborne pathogens are microorganisms that can cause disease when transmitted from an infected individual to another. They are capable of causing serious illness and death. The most common illnesses caused by bloodborne pathogens today are hepatitis B, HBV, hepatitis C, HCV, HIV, human immunodeficiency virus, which can cause AIDS, acquired immunodeficiency syndrome. Persons infected with AIDS are unable to fight infection and other diseases. Currently, there is no known cure. Hepatitis B is a disease affecting the liver. Persons with hepatitis B will experience flu-like symptoms. Hepatitis B is treatable, but prompt and proper treatment is necessary. A vaccine is currently available to protect you against this disease. Hepatitis C is also a disease affecting the liver. 80% of persons infected have no signs or symptoms. Symptoms can include loss of appetite, nausea, or fatigue. Currently, there is no vaccine against hepatitis C. Transmission of bloodborne pathogens occurs through the blood and bodily fluids. Bloodborne pathogens can enter the body through a cut in your skin from a contaminated sharp object, such as broken glass, and contaminated blood or bodily fluid that enters our eyes, nose, or mouth. The transfer of infected blood or bodily fluid on our skin can occur through open sores. Our skin provides a natural barrier. However, tiny cuts or cracks in the skin can allow these viruses to enter the body. Hepatitis, not HIV or AIDS, can be transmitted through dried blood. Any bodily fluids that are visibly contaminated with blood and all bodily fluids in situations where it is difficult or impossible to differentiate between body fluids have the potential to be contaminated. Blood in bodily fluids may not always appear bright red. At times, it can be shades of brown and black.
It's difficult to know if someone is infected. It's best to be cautious and treat every person as if they are infected. The best guideline to follow is universal precautions.
When transporting or assisting your passengers, always use the Oregon Occupational Safety and Health Administration's universal precautions. Always assume that in an accident involving a spill or first aid, all blood or other bodily fluids are infected with hepatitis B, HBV, hepatitis C, HCV, the human immunodeficiency virus, HIV, or some other infectious agent. An incident could occur where an ill person may vomit. For example, a chemotherapy patient coming back from treatment who may be at risk of getting sick in the vehicle. A rider who might skin their knee or shin on a high step of a van or bus. A rider may also have an uncontrolled incident before making it to a bathroom. And take extra care when transporting patients who have recently undergone dialysis treatment. These are but a few examples to increase your awareness and help you understand why it's important to take appropriate precautions. So how do we protect ourselves against exposure during incidents and cleanup procedures? Being cautious beforehand to prevent any entry of a virus into the body is essential. Our skin is our first layer of protection, but any cut, crack, or rash can break down that layer of protection. Keep your skin healthy. Cover any open or cracked areas. Wearing protective gloves is another method to reduce any risk of exposure.
To obtain these and other protective items, your transportation provider will equip you with a bodily fluids cleanup kit, also known as a bloodborne pathogens kit for your vehicle. This kit should contain the following: latex gloves, mask and eye shield, clothing protector, absorbent solidifier, absorbent towels, scoop and scraper, disposal bag, red infectious waste bag with biohazard shield label, decontaminant, and antiseptic towelettes. OSHA requires that your transportation provider supply you with the appropriate protective equipment and materials necessary to decrease risk from exposure to any bloodborne pathogens. In all cases, it is necessary to leave gloves on for the duration of an incident. All items in your kit serve to protect you in the best way possible from hepatitis B, hepatitis C, and HIV exposure. All vehicles, including your personal vehicle used in transporting passengers, should be stocked with a bodily fluids cleanup kit. A first aid kit is not the same. Only a bodily fluids cleanup kit has the necessary products that will minimize exposure from an infectious virus. The kit should be placed in a convenient location in the vehicle for easy access in case of an incident. If the vehicle you're driving already has a kit, include checking the kit for missing items in your pre-trip inspection. Contact your transportation manager to restock your kit if items are missing or look used.
Personal protective equipment is expected to be used whenever there exists an anticipated risk of exposure to the skin, eyes, and mucous membranes with blood or other potentially infectious materials during the driver's and escort's duties. Eating, drinking, smoking, application of cosmetics, lip balm, and handling of contact lenses is prohibited in areas where there exists the threat of exposure to bloodborne pathogens.
As a community transportation driver, you're an expert at providing safe, reliable transportation. Therefore, if an emergency occurs, it's best to call an expert to provide medical assistance. If an emergency occurs, pull over as soon as possible. Secure the scene, passengers, and yourself. Contact Emergency Services 911 if needed, and contact your transportation provider. Observe universal precautions. Assume that all human blood and human bodily fluids are infectious.
Wear protection whenever you suspect the threat of splashes, sprays, spatters, or droplets of blood or other potentially infectious materials that may reach the eyes, nose, or mouth.
Remove protective equipment when it becomes contaminated and before leaving your vehicle. Place all used protective equipment in the biohazard bag. Some persons may temporarily and briefly decline to wear personal protective equipment only under extraordinary circumstances. It's always best to call an expert to provide medical assistance. Ask your transportation provider about your company policy. In the event of an incident, reach for your bodily fluids cleanup kit in the vehicle to access your personal protective equipment. Put on gloves as a first precaution before addressing any situation with your passengers. To properly clean a bodily fluid spill, apply absorbent solidifier or absorbent towels to the spill. Use the scoop and scraper to pick up the solidified fluid. Clean the area of the spill with a decontaminant. Place all discarded material in a leak-proof disposal bag. If a rider needs assistance with personal cleanup, assist with antiseptic towelettes. Sharp items, sharps, such as broken glass, can cut gloves, putting you at risk. Be sure to use your scoop and scraper to pick up any sharp items and place them in a puncture-proof container. All items should be discarded into the biohazard bag. Take note of the biohazard symbol on the bag. Any containers or bags with this symbol are to be used for all materials containing blood and any amount of bodily fluids. You will find red bags with the biohazard symbol in your bodily fluids cleanup kit.
If you notice this symbol in other areas than in your bodily fluids cleanup kit, be cautious. The items inside will most likely contain infectious blood or other potentially infectious material. Red bags or containers may be substituted for this label. When finished, remove your gloves. Remember, the potential contaminant is on the outside of the gloves. To remove your gloves, pull from the wrist up toward your fingers with your gloved hand. Place the removed glove in the gloved hand. It's important to reach into the glove to prevent any contamination with what may be on the outside of the glove. Pull the remaining glove off, turning it inside out as you pull it over your fingers. Throw both gloves away in the red biohazard disposable bag and wash hands with soap and running water. If you are unable to wash them with soap and running water, wash your hands briskly and thoroughly with the antiseptic towelettes, then wash with soap and running water once you return to the office. Bring any filled bags to your transportation provider. They are equipped to properly dispose of all contents. Complete an incident report as soon as possible. Your transportation provider will supply you with the form and instructions on how to fill it out.
Wear appropriate gloves when there is a risk of contact with blood or other potentially infectious materials, and when handling or touching contaminated items or surfaces. Replace gloves if torn, punctured, contaminated, or if they no longer function as a barrier for other reasons. Feel free to use as many gloves as necessary to complete your task.
The threat of contracting hepatitis B primarily exists with those persons who have occupational exposure, meaning any possible exposure during the performance of their normal job duties. Certain passenger groups pose a higher risk of infection than others. If a risk has been identified, your transportation provider may require a vaccination. Unless a hepatitis B risk has been identified, your chances of exposure are minimal. The hepatitis B vaccination series is offered to all drivers and escorts as needed. If you feel a risk is present, you've been exposed, your duties change, or your risk of exposure increases, contact your transportation provider with any questions or concerns.
How is an exposure incident defined? It's an exposure to or contact with blood or other potentially infectious material through broken skin, through the eyes, nose, or mouth, or by means of a wound, such as a needle stick. In the event exposure has occurred, please report the incident to your transportation manager immediately. The driver or escort should document the exposure incident. Your transportation provider will supply you with this form. Drivers and escorts are encouraged to meet immediately with their physician. A post-exposure evaluation and follow-up will be performed by your transportation provider agency. All results and information regarding the individual thought to be infected and the exposed are to be kept confidential. The exposed individual has the legal right to know the hepatitis B, HBV, hepatitis C, or HIV status of the infected person. In turn, the privacy rights of the infected individual cannot be violated. If you want more information, talk to your transportation manager or safety director. The transportation provider you work for wants to take every precaution for your safety. They will continuously follow the Oregon Occupational Safety and Health Administration's, or OSHA, guidelines, with emphasis on universal precautions, and implement training to minimize driver and escort contact with blood or other potentially infectious materials, as seen in this video and training packet.
The Oregon Occupational Safety and Health Administration standards include definitions surrounding involvement with bloodborne pathogens, methods of compliance, and guidelines for developing an exposure control plan. Transportation providers use these standards to develop exposure control plans that include a schedule and method for delivering this written standard. This video and training program are an example. In what situations drivers and escorts may be at risk of exposure, and procedures for evaluating the events surrounding an exposure incident.
To ensure the most effective current methods for your protection, this information will be reviewed regularly and updated whenever new tasks and procedures affect drivers and escorts' current on-the-job exposure status. Now, your transportation provider will supply you with a copy of their exposure plan and answer any questions you may have. This should help you better understand the need for caution and prepare you to deal with any potentially infectious materials. Remember, preparation, safety, and training is your key for a safe trip.